Hepatitis B is caused by a virus. This virus is much easier to transmit than the HIV virus and the hepatitis C virus. Hepatitis B can be transmitted sexually as well as via blood-to-blood contact, so both sex without a condom and sharing drug injecting equipment could put you at risk of getting hepatitis B. Hepatitis B infection can only be diagnosed with a blood test. Specific blood tests can tell if you have an acute infection or a chronic infection. Tests can also show if you have been exposed to the virus but cleared the infection yourself, or whether or not you've got full immunity from vaccinations you've had in the past. If you've only had 1 or 2 of the 3 injections required for the hepatitis B vaccine, you may not have complete protection. If you have hepatitis B and don't clear it, the virus can infect others who have not already had the vaccination.
Chronic hepatitis B, infection that has lasted more than 6 months, can go on to cause scarring of the liver and in some people an increased risk of developing liver cancer. If you do have hepatitis B, it's not the end of the world. There is treatment available in Australia for chronic hepatitis B. In chronic hepatitis B, the aim of treatment is to decrease the damage to the liver rather than to clear the virus. This treatment is funded. That means you don't have to pay for it and can be given through special liver clinics at major public hospitals. It's important to be realistic about how good you want to be with diet, alcohol and drug use, but understand it really is important to try and minimise any extra damage to your liver. So if you do have chronic hepatitis B, you'll stay healthy for longer if you can minimise your drug and alcohol intake and be kind to your liver by eating as healthy a diet as you can, no matter what your living situation is.
The symptoms of acute hepatitis B and the severity of these symptoms can vary from person to person. If you get hepatitis B as an adult, you can become quite sick with nausea, fever, pain, and yellowing of the skin and the whites of the eyes, a condition called jaundice. Some people with acute hepatitis B will need to be hospitalised due to the impact the virus has on the liver. Although the symptoms of acute infection usually disappear over a few weeks, you do need to be regularly monitored by a doctor. And anyone you're having sex with really should have a sexual health check and be vaccinated against hepatitis B as well. Transmission is caused by contact with blood that contains the hepatitis B virus. This contact can occur in the following ways: sharing injecting drug equipment, getting a tattoo or piercing with non-sterile equipment, or if an infected person's blood comes into contact with open cuts, sores, or more rarely, eyes.
It's also important to think of what's known as household contact. This means you need to be careful not to share anything that may get traces of blood on them, things like toothbrushes, razors, or clippers. If a razor or toothbrush had traces of blood on it, that blood could get into someone else's bloodstream via a cut or sore in their mouth or on their skin, and they too could become infected with hepatitis B. The same goes for injecting equipment. Better to have your own stash of fits so that you're never tempted to share. Because of such situations, it's good to let people you're especially close to know if you have hepatitis B. They may have it too, or need to be vaccinated to prevent being infected. If you are unsure about disclosing such information to your friends, family, or partners, talking to a worker from your health service could help.
But let's not get too carried away. Hepatitis B cannot be spread by sharing knives and forks, by hugging and kissing, or from contact with toilet seats. Hepatitis B can be spread through sexual contact when people have unprotected sex. Condoms should be used for all sexual partners. You are especially at risk if there is any blood involved during sex, for example during anal sex, or if you have any cuts or sores on your vagina or penis. Using condoms will help prevent the spread of hepatitis B, but the best prevention is for people, especially those at risk, to be vaccinated.
Hepatitis B can be spread from mother to baby if the mother has a chronic infection. This usually happens shortly after birth. This is why all newborns in Australia are vaccinated. Prevention of hepatitis B is everybody's business, so make sure you are vaccinated and encourage all sexual partners to be vaccinated. Adults require 3 injections to build immunity against hepatitis B. The course can take up to 6 months to complete, although sometimes a fast course is given over 3 months. Make sure anyone that you live with has up-to-date vaccinations, including children, other family members and flatmates.
Be sure to cover any open wounds or cuts, especially if you play sport, and leave the field if you have a bleeding injury. In sport, this is called the blood rule and applies to everybody, so you don't have to disclose your hepatitis status. Having a thorough sexual health checkup if you have any unusual symptoms or signs will mean hepatitis B and any other sexually transmitted infections will be picked up and treatment can be given. If you've got hepatitis B and want to have a chat about it, a good GP, specialist health worker, or specially trained hepatitis nurse can help with this. Remember that hepatitis B is quite difficult to understand, so you'll probably need to read a lot, reread information, and ask lots of questions.